In my fourth year of medical school, I encountered a patient in the emergency room. Let's call him John. John was in his 60s. He was a pretty healthy guy overall. He was really into fitness. He had a solid diet, solid workout regimen, and he even took supplements. He would track his steps, his blood oxygen, and his pulse rate, all through his smartwatch. And for a few nights in a row, John noticed that his heart rate was higher than normal. He brushed it off. He felt fine. I mean, he didn't have any other concerning symptoms we'd usually worry about. But when he was going to bed on that third night and his heart rate was still elevated, he decided it was serious enough to come and see us. Now, I'll admit that back then, even in medical school, I had my bias. Wearable tech, so I'm talking about Apple Watches, Fitbits, Garmin's, all of that was still relatively new. And too often, we saw patients in a panic over what turned out to be an inaccurate or misread piece of data. In 2019, when I was in a cardiology clinic in Texas, we'd regularly get worried patients coming in due to being terrified by an ECG that their smartwatch had generated for them. Now, even though those squiggly lines looked like something terrible was about to happen, often it was usually due to the watch bouncing around on the wrist or just not being properly placed. If you combine shaky data with anxious patients, it's a recipe for a lot of sleepless nights. But for John, it was a completely different story. His labs came back, and I couldn't believe it. He was having a mild heart attack. There was no crushing chest pain, no arm numbness, no sweating, just a subtle clue from his wearable. If he had waited for his symptoms to worsen, there's a chance that he wouldn't be around today. Seeing firsthand how a simple smartwatch reading saved John's life opened my eyes to this truth. Technology and innovation can be our greatest weapons in the battle for health. Wearable tech, such as smartwatches, fitness rings, continuous glucose monitors that go in your arm, all of these deliver real-time data about our bodies right to our wrists. In the past, if you wanted any data about your blood sugar, your heart, your lung capacity, you had to book an appointment, commute to the clinic, and wait in line just to see a healthcare provider. In that type of a system, a reactive system, patients come to us and they already have problems. But today, the groundwork is in place for a future where patients can collect crucial health information anytime and anywhere, detecting health issues before they get worse. And yet, wearables are just one side of this coin. Another critical innovation I want to discuss with you today is telemedicine. The COVID-19 pandemic, with all of its challenges and heartbreak, also acted as a powerful catalyst for change. Medical students like me were trained on the importance of a thorough physical exam, pressing on the abdomen, observing breathing patterns, and checking for reflexes. All of these are vital diagnostic tools. But suddenly, in a socially distanced world, we discovered that not only can healthcare be delivered online, in many cases, it can be done effectively and safely. Chronic conditions like hypertension, diabetes, coughs, colds, and even mental health issues can all be managed remotely, thanks to telemedicine. This means that our emergency rooms are less congested, and we can address those in more urgent situations. It means that if you just need to refill your hypertension medication, you don't have to commute 4 hours to your nearest hospital. It means that even if you don't live near the big cities, you can still have access to some of the best doctors in the country. As you can see, the power of telemedicine isn't just about routine checkups. It's about removing physical barriers. Now, one big problem that we have in the Philippines is that we have some of the highest maternal mortality rates in Southeast Asia. This means that when women in this country go to deliver their babies, they have some of the highest complication rates in the region, which can lead to unstoppable bleeding and, unfortunately, death. The Innovation and Research Group, a nonprofit organization I helped to found, looked into this issue of maternal mortality and how we could address it. And one of the biggest problems we found? Lack of ultrasounds. In pregnancy, ultrasounds give us a direct view into the health of the baby. It's so important, in fact, that governments and health agencies around the world recommend getting at least one every trimester. This allows doctors to see the baby's heartbeat, make sure that they're growing well, and ensure that the mother is not in a high-risk pregnancy. But because of a lack of funding, a lack of ultrasound specialists, and a lack of ultrasound units, especially in the more remote provinces, these pregnant women were not getting the scans that they so desperately needed. Sometimes the baby's upside down. That's called a breech birth. Sometimes the placenta is blocking the birth canal and blocking the baby's way out of the womb. That's called placenta previa. And sometimes the mother is having twins and she wouldn't know about it. Without an ultrasound to check these things routinely, if a mother goes to deliver in a clinic that is not equipped with an OBGYN or a surgical specialist, it can often be at severe risk of bleeding, even death. Our answer: if patients can't go to ultrasound specialists in the city, we need to try and bring the specialists to them. By partnering with NGOs and technology companies, we were able to distribute portable ultrasounds about the size of a lunchbox and have been bringing them to the remote clinics and testing an interface that would allow ultrasound specialists in Manila to conduct exams on patients no matter their geographical location. It's our hope that by harnessing the power of telemedicine, we can give these pregnant patients the chance to have healthy and happy babies. So, we've seen how wearables can bring data from our wrists to the doctors and how telemedicine can break down physical barriers. So now, let's talk about the next frontier in medicine, the technological elephant in the room, artificial intelligence. Now, AI has become something of a buzzword, right? Your coffee machine, your vacuum cleaner, your TV, all of this is supposedly running on the magical AI. And it can be hard to take this revolutionary technology seriously when we're all using it to make our friends and family look like Studio Ghibli characters. But once you get over the gimmicky headlines and the silly use cases, you can see that there is real, groundbreaking potential here. Now, I recently took the US medical licensure exams, and these exams are required for medical students who want to pursue residency and further training in the United States. There's 3 of them. We call them Step 1, Step 2, and Step 3. These are brutal, 7 to 8 hour long exams. Some of them are spread over 2 days. Medical students spend months studying for these tests, doing thousands of practice questions, reading page after page, and taking multiple simulation exams just to have a chance at passing. So what happened when ChatGPT 4o was asked to take the US Medical Board exams? It got 92% on Step 1, 94% on Step 2, and 93% on Step 3. Those are higher scores than any human has ever achieved since the exam was created. And the worst part, ChatGPT 4o wasn't even specifically trained for this exam. It can still give you the world's greatest tomato soup recipe, make a killer itinerary for your trip to Italy, and of course edit your prom pictures to look like a Disney movie. But the potential of AI goes far beyond exams and recipe suggestions. Already, we're seeing AI algorithms interpret imaging scans with remarkable accuracy, sometimes faster and more precise than human experts. We're seeing applications that can scour massive data sets, billions of data points, to help clinicians make more data-driven decisions. And we're seeing AI tools that could help personalize treatment plans, predict surgical outcomes, and even triage patients in busy emergency departments. But of course, with every groundbreaking technology comes the challenge of responsible use, data privacy, cybersecurity, the need for well-trained professionals and experts to actually interpret what the AI is saying. These are all hurdles that we have to face. But if there's one thing I've learned from my experience with John's smartwatch and the ultrasound project, it's that the right use of technology in the right hands can quite literally be the difference between life and death. So, where does that leave us? We stand at a crossroads in healthcare. One where we can remain in the old paradigm of reactive medicine, waiting for the patient to show up at the ER, or we can continue to innovate, collaborate, and adapt. We have wearable devices that empower patients with real-time data. We have telemedicine platforms that allow us to reach across mountains and across oceans to deliver care. And we have AI systems poised to take healthcare into a future once reserved for science fiction. My challenge to you, to all of us here, is to embrace this transformation wholeheartedly, but also responsibly. If we do, we'll not only save lives like John's, will unlock a new era of healthcare that's more proactive, more personalized, and more compassionate than we've ever imagined. And that future is within our reach. And with the amazing tools at our disposal, the wearables on our wrists, the telemedicine across our screens, and AI as our partner in care, it's not a question of if healthcare will evolve, but how boldly and how quickly. So let's be bold, and let's do it together. Thank you for your time.